Welcome to www.healthsourcechiro.com. Today's topic, back pain isn't what brought me to the chiropractor. Most people think visiting the chiropractor would mean you have some sort of back pain. However, my story is a little different. A couple of months ago, most of my body woke up, but I noticed that my left leg was still asleep. I didn't think much of it, but it bothered me for the entire day. I thought I probably slept in a weird position. When I went to bed that night, I put my leg on a pillow to make sure it would feel better when I woke up. The next day, I woke up with the same problem. This continued for about a week before I got really worried. I didn't suspect that there was anything wrong with my spine because my back didn't hurt. I was more afraid of something like diabetes or blood clot was causing the numbness in my leg. So after talking to a friend of mine who happened to be a registered nurse, I was persuaded to make an appointment with her chiropractor. I was surprised by the amount of concern she had for my back because I was only starting to have back pain, which I thought was just a natural result of having to use one side of my body over the other. It turned out that I had pinched a nerve in my back that resulted in a bulging disc. The injury could have been much worse had I held off seeing a chiropractor any longer. It also could have been much better if I'd been more careful with my back in that first week that I was so worried about my leg. I have to admit that I should have seen a chiropractor much sooner. Without the constant crippling back pain that we have come to associate with a bulging disc, having a doctor or a chiropractor look at my back didn't seem to be a priority. We were never able to determine the specific cause of my bulging disc, but I should have been more careful with my back. Turns out some very simple exercises prevent back problems before they occur. 3 best categories of exercise to prevent back pain. Number 1, aerobics will condition your heart and muscles. These kinds of exercises help you maintain your health and speed recovery time. With having back trouble, you should reduce your normal workout but get your heart rate up. Number 2, strengthening routines will also help. Focus on your back, abdominal, and leg muscles. Be careful to not overexert yourself. Number 3, stretching exercises will keep your muscles and other supporting tissue flexible and less susceptible to injury. The best long-term strategy for your back involves awareness. You should be aware of measures that you can take to prevent back problems and the common indications of spine disorder. It will take time and effort, but you'll be amazed how quickly you see improvement and have more energy. If you can work a little bit of knowledge of exercise into your lifestyle, it'll be a load off your back. For more information on topics like this, go to www.healthsourcechiro.com.